My name is Jennifer White, and I am a licensed practical nurse in the baccalaureate program at Indiana State University. This is my health education project in the spring of 2021 for Community Health Nursing Class 444. I will be discussing celiac disease. By the end of this presentation, the participant should be able to 1. Define celiac disease. 2. Identify the cause of celiac disease. 3. Examine manifestations of celiac disease. And finally, consider the treatments for celiac disease. Please pause the video here and take the pre-test listed in the comments below. Celiac disease was originally identified over 8,000 years ago by a Greek physician named Arterius of Cappadocia. This gentleman acknowledged that some foods affect digestion in humans. When people transitioned to a new way of eating after the agricultural revolution, their guts were introduced to new antigens, and some people were unable to adapt. This disease was readdressed in the 19th century by Dr. Matthew Bale. He observed a disorder in adults that caused chronic diarrhea and malnutrition and hypothesized that the diet may be a factor. His observations were pretty much ignored by the medical community, and it took an English doctor named Samuel Gee to reintroduce this disorder. Once again, the symptoms of this disorder were tied into the patient's diet. The banana diet was introduced in the 1920s by Sidney Hawes. This diet was successful in alleviating the symptoms of abdominal distress, and because of this, it was proposed that the cause of celiac disease was carbohydrates. It was later proven by a Dutch pediatrician that wheat protein was the cause of this disorder, Fasano, 2009. Celiac disease is an inflammatory disease that affects the small intestines of approximately 1% of the population of the world. Celiac disease is caused by the ingestion of gluten protein, which is found in wheat, barley, and rye. When people were nomadic and before agriculture was discovered, these proteins were never ingested by humans. It was only after humans began planting, cultivating, and eating grains did this problem become evident. Many well-fed people, especially children, probably died due to malnutrition from celiac disease before it was understood. It is only in the last few decades that the etiology of celiac disease has been understood. It is now known that this is an autoimmune disease that attacks the villi in the small intestine and interferes with the absorption of nutrients. The body produces an antibody to the tissue transglutamine enzyme. This antibody also attacks healthy cells in the attempt to rid the body of this enzyme, Fasano 2009. This is also indications that there may be a genetic component to the celiac disease. Celiac disease has many presentations. The main manifestation of celiac disease is intestinal disturbance. This can include chronic diarrhea, gas-induced bloating, severe abdominal pain, fatigue, and failure to thrive. In fact, the symptoms of celiac disease closely mirror the signs of gallbladder disease and can be routinely misdiagnosed. Due to the damage caused to the small intestine because of the inflammation, the body is unable to break down foods and absorb nutrients normally. It has been discovered recently that there are also non-intestinal symptoms that are caused by celiac disease. In children, these symptoms can include anemia, delayed puberty, decreased dental enamel cell structure, oral ulcers, and liver disease. Another common symptom of celiac disease is dermatitis herpetiformis. This is an itchy red rash that comes and goes intermittently, usually when the person is under stress. The treatment of this skin disease condition are antibiotics and a strict adherence to a gluten-free diet. The only definitive treatment for celiac disease at this time is a strict gluten-free diet. While this may sound easy, there is hidden gluten in many foods and products that are manufactured. Patients diagnosed with celiac disease take label reading to a whole new level. Not only do they have to watch for flour-based ingredients, but also for other ingredients that most people can't pronounce, let alone spell or recognize. Many cosmetics are made with a gluten base because gluten is considered a binder, and exposure even through the skin can cause symptoms of celiac disease to flare. There is the added problem that many gluten-free products are extremely expensive because for many years a gluten-free diet was considered a fad diet, so manufacturers were able to inflate prices. As an example, the cost of a small loaf of gluten-free bread, which is generally half the size of a normal loaf of bread, can be as high as $10 a loaf. Gluten-free foods also have a different texture that can affect the palate of some people. And finally, even when the product states that it is gluten-free, if it is manufactured in a facility that also produces gluten products, the risk of cross-contamination is very high. It only takes a very small amount of gluten to cause symptoms. Studies are being done now on therapeutic approaches to celiac disease that include beta-glucanase and other enzyme blockers or supplements to assist with the digestion of gluten. One proposed treatment that has interested myself is NexVax2. According to Nestran et al. 2020, this is a vaccine that is aimed at restoring long-term gluten tolerance by desensitizing the immune system. This vaccine could lead to a return to a normal diet and quality of life that people were used to before the diagnosis.